Minister, yesterday I raised with the Taoiseach the overcrowding crisis at University Hospital Limerick, and he sought to downplay the severity of the situation. Indeed, listening to Leo Varadkar, you'd be forgiven for thinking that the dire problems at the hospital were a figment of people's imaginations. But this morning, Minister, we wake up to the news that the crisis continues. There are nearly 100 patients on trolleys at University Hospital Limerick. The hospital remains in its highest state of escalation. All beds across the hospital group are being used for surge capacity. Surgeries have been deferred for a second day in a row. People are again asked to avoid coming to the emergency department. GPs and pharmacies themselves, already under huge strain, are being asked to help alleviate the pressure on the hospital. Day after day, week after week, month after month, vulnerable people are left without a hospital bed. The emergency department is dangerously overcrowded. Doctors and nurses are forced to treat patients in appalling conditions. In 2007, Minister, your party promised to end the scandal of patients on trolleys. That was the Fine Gael rhetoric. That was nearly 20 years ago, and things have only gotten worse. There is now a state of emergency for healthcare in Limerick and the Midwest. The writing has been on the wall for months as regards the escalating crisis at University Hospital Limerick. So why hasn't government stepped in? Why hasn't the Minister for Health stepped in? That's what the people of Limerick and the Midwest are asking. The root cause of the crisis is clear. Government hasn't made the necessary investment into University Hospital Limerick. This has created serious and persistent capacity and staffing problems. Yesterday, the Taoiseach acknowledged that the population of the region is growing. That's true. But what he didn't acknowledge is that government hasn't increased even the target for bed capacity to meet this reality. The Taoiseach denied the staffing problem, but there is in fact an urgent need to recruit non-consultant doctors, additional nurses and medical staff for the emergency department, and more staff needed to extend the operating hours of the acute medical unit. Limerick and the Midwest region also need protected capacity for planned procedures. So we need to know now when the surgical unit promised last summer will be delivered. Minister, the government needs to act now to relieve the intense, unsustainable pressure at University Hospital Limerick to ensure that people can access their hospital and get the care they need in a timely and a safe fashion. Tá stad éigeandála in ospidéal de Hullscoile Limnach. Ní mór ag an rialtas aig a thuairt ar an ngearcéim agus gníomhú éigeandála a thógáil Loireach. Minister, the people of Limerick and the Midwest region deserve far better than a never-ending crisis at their hospital. So can I ask you, firstly, do you accept that there is a state of emergency at University Hospital Limerick? And secondly, what action does government propose to take now, immediately, to relieve this pressure and to finally tackle this crisis?
Deputy, thank you for raising this issue again today. University Hospital Limerick is currently caring for, as we know, an exceptionally high number of unwell medical patients in the hospital. And the emergency department has seen its highest week of emergency presentations since the beginning of this year. UHL is currently at its highest state of escalation. Surge capacity has been opened at UHL and across other hospitals. Scheduled activity across all sites was deferred and will remain under review, with only urgent and critical and time-critical patients, including cancer patients, going ahead. The emergency department remains open 24/7, and urgent care is being delivered to those who need it most. But people who are presenting at ED who are not suffering with life-threatening or severe illness or injury will face a significant wait as we speak. The government, as you say, is stepping in, has invested significantly in University Hospital Limerick and will continue to do so. Staffing at the hospital has grown by over 1,000 since the end of December 2019, from 2,814 to now 3,854 at the end of November last year. That represents an increase of 37% in staffing in that period. It includes an extra 146 doctors, 45 more consultants, 348 more nurses and midwives, as well as 84 more health and social care professionals. And we will continue to invest as much as is necessary. In 2019, University Hospital Limerick had a budget of 265 million. In 2023, that budget was 383 million, meaning that its budget has grown by 118 million over that period. That's an increase in 45% and badly needed in just 4 years. We're also investing, as you asked yesterday, in bed capacity, which is badly needed at the university. 150 additional beds have been opened in the UL Hospital Group since 2020. 98 of those beds have been in University Hospital Limerick. We're seeing another 96 beds being progressed as we speak, which will open early next year, and towards the end of next year, we'll see a further 96 beds being added to UHL. So the calls for more investment, more capacity, more staff are being met by government allocation of resources, and we will continue to do that to address what is a significant pressure in this hospital. I want to thank the staff that are working in difficult conditions, and I want to reassure them that the government will apply the necessary resources to ensure that capacity at the hospital increases, both from a beds perspective and a staffing perspective where necessary. From a management perspective, Sonia Cotter, the Assistant National Director of the HSE, has been acting CEO of ULHG since the 14th of February. Professor Cowan, the CEO, is on leave, and the acting CEO will discharge duties in the context of that role. And Sandra Broderick has been appointed as the Regional Executive Officer of the HSE Midwest Region and started in late December. The HSE Midwest Region includes, as you know, Limerick, Tipperary and Clare. So this is a priority and a focus for government right now, but as you called for yesterday and as the Taoiseach outlined clearly yesterday, what's needed here is increased capacity, more resources and a focus on better management. All of that's happening.
So I asked you, Minister, to share with us your view as to whether or not you accepted that there's an emergency at University Hospital Limerick. I can only judge by your response that you share the Taoiseach's view that in fact government has done enough. And I want to reiterate again today that that is not the case, that you are frankly delusional on this matter. I've described to you, and you echoed the facts on the ground: overcrowding, cancellation of surgery. I should also say, Minister, and recall that lack of resources, pressure, lack of capacity has real consequences, real life consequences for staff, for patients, for lives. Lives have been lost at University Hospital Limerick. You know, I'm sure, all about that. Investigations into those matters are underway. And what the people of Limerick and the Midwest region cannot fathom or accept is that in the face of that loss of lives, lack of capacity, dire overcrowding, cancellation of surgery, that government continues to sing the song and parrot the rhetoric that all is well. The resources are insufficient. The staff capacity is insufficient. The bed capacity is insufficient. When, oh when, will government address that fact?
Deputy, we're not singing any song. Stop trying to misrepresent the position here. This is a situation where a very significant hospital in the country is under a lot of pressure. We are putting in place significant resources to respond to that pressure, but of course I acknowledge, as does the government, the difficulties that staff face and patients face today and yesterday and this week in the context of UHL. The pressures in this hospital are not new, which is why we have dramatically increased resources and will continue to do so until the capacity pressures are resolved. That's why, for example, we are now in the process of adding 2 new blocks in terms of more beds, of 96 extra beds. One will open in the first quarter of next year, the next will open in the fourth quarter, I understand, of next year. So there is, of course, an acknowledgement that all is not well in University Hospital Limerick when you compare it to the performance of many other hospitals around the country, and that is why we need to address those issues, which is primarily a capacity and resourcing issue.
Thank you,
but I can assure you the government will continue to add more beds, add more staff, and improve management of the hospital.
Minister Coveney, 2 days. That's how long the son of pharmacist Niall O'Sullivan waited on a trolley in University Hospital Limerick Emergency Department before receiving treatment for a fracture. And Mr O'Sullivan spoke of his son's experience powerfully on RTE radio this morning. Minister, this is not the first time that I've raised the human impact and the dangers of hospital overcrowding with you. We spoke about this just last month. But clearly nothing has changed in UHL, and indeed the crisis has worsened, as I think you've acknowledged effectively. But it's not just UHL and it's not just Limerick. Another woman I am in contact with spent a hellish night, last night, in Tala Hospital. Upon presenting there with pain at 4 o'clock yesterday, she was left in a waiting room until 9 a.m. today. No pain relief, nothing. Another family, this time in Vincent's in Dublin, had a similar ordeal. I heard from a parent who had to prop his daughter against a wall because she had been left waiting on a chair with an injury which developed into blood poisoning. She was propped up because she was dipping in and out of consciousness from pain and exhaustion, and despite that, there was no capacity to give her timely care. So these cases are not isolated, Minister. Whether it's UHL or Tala or Vincent's or CUH or James's or anywhere else, every day now, sick people who go to hospital in Ireland seeking treatment are arriving to find that it's just not there for them, largely due to overcrowding. And the word which comes up from people who describe their experiences to me, and time and again, is chaos. And in a hospital where patients expect to receive care, what they're receiving is chaos, Minister. They're subjected to chaos. And that's not to mention the nightmare this is causing for healthcare workers. Among the junior doctors and nurses who've contacted me about their experience is a young medic who says he's looking for work in Australia or Dubai. Pay is a factor for him, yes, but what keeps him up at night is his fear around overcrowding and lack of staffing. Because he's so overworked and because he so often must look after more patients than he should be allowed to do, he's scared that something will go wrong and that he will be blamed, or indeed he'll blame himself. And healthcare workers who are providing an essential and indeed heroic service, Minister, deserve better than that. There's a shocking reality, Minister, that of the 10 HICWA reports carried out in Irish hospitals in the last 11 months, not one hospital has been found fully compliant when it comes to staffing, not one. This at a time when it needs to be all hands on deck, and instead what we're seeing effectively is a sinking ship. We know from parliamentary questions my colleague Deputy Duncan Smith has received that the HSE is unable to guarantee, even to workers on a career break, that they won't be impacted by the recruitment freeze. Yet each time we mention the freeze, you deflect. The Taoiseach says it's not having an impact, that the HSE is hiring. But it's plain for everyone to see there's just not enough staff in our hospitals, and so healthcare workers and patients continue to be placed in harm's way. So, Minister, can you offer us a substantial reply, not simply saying it's desirable to tackle understaffing and overcrowding, and how can you stand over a situation where hospitals are not fully staffed?
First of all, Deputy, there are many hospitals in the country that are performing really well, that don't have patients on trolleys and would have had in the past, that have seen waiting lists come down significantly on what they were in the past. And that is happening because of good management, more staff and more resources. We have a larger health budget now than ever before, and rightly so, because our population is growing and ageing. But in relation to the specifics of the question that you answer, there's been an unprecedented level of investment by this government in the health service workforce in recent years. We've seen consistent growth in the workforce each year since 2020, with the growth in the number of staff recruited in 2023 being the highest since the foundation of the HSE. There are now 26,000 172 more staff working in our health service than there were at the beginning of this government. In this period, that includes an additional almost 8,500 nurses and midwives, more than 4,000 health and social care professionals, nearly 3,000 doctors and dentists. That's a 22% increase, meaning that for every 5 people working in the health service in 2020, we now have 6. In November 2023, it is true the HSE CEO announced a pause in all recruitment, with the exception of consultants, graduate nurses and doctors in formal training programmes. This recruitment pause put in place was part of a suite of control measures, included an instruction to reduce expenditure on agency staff and management consultants across the HSE. The reality, though, is that the HSE had already exceeded its 2023 funded workforce targets, which was not sustainable. There are now 146,500 staff working in our health service. The HSE has funded to recruit just over an additional 6,000 staff in 2023, but in reality, it actually hired well over 8,000, meaning that they had more than 2,200 staff more than they were funded for. Funding for an additional 2,268 staff has been secured by the Minister for Health for this year. So there's a lot of talk about recruitment freezes, Deputy, but there are a lot more people coming into the health service, and badly needed. And we will continue to ensure that the health service grows and expands and is invested in as our population grows and becomes more demanding, given the fact that it's an ageing population as well. But I think, while of course we acknowledge that some hospitals are under significant pressure, if you look at the health system as a whole, actually waiting lists are down, trolley numbers are down, staffing numbers are up, bed numbers are up. And we need to focus on, of course, hospitals like UHL that are under significant pressure and others that are feeling pressure, but we need to recognise the successes of many hospitals that are performing really well for patients as well.
Minister, your response could be characterised as nothing to see here, and that's clearly not an adequate answer for all of the patients who are languishing on hospital trolleys, for the overworked staff, for those whose procedures at UHL have been cancelled without any indication as to when they will actually take place. Every time we raise the reality of overcrowding in hospitals and understaffing, you and your government colleagues respond with metrics, with figures, the patent fact is that the spending is not enough to meet the demand. And that's evidently true. It's evidently true from HICWA reports. It's evidently true from the experiences of patients and the experiences of overworked staff in understaffed hospitals. So, Minister, can I ask again, where's the sense of leadership? Where's the sense that somebody is steering this ship? Where is the sense that there's going to be all hands on deck to ensure that the crisis in hospitals is addressed, that we can retain staff, that we can recruit enough staff to support consultants, to supply the teams that are needed to ensure the procedures can take place? And when will we see the real action to address the overcrowding that continues to persist in far too many hospitals across the state? Not just in Limerick, but undoubtedly Limerick is a particularly egregious example of understaffing and overcrowding and consequent harm to patients and staff alike.
Minister to respond.
Deputy, I accept what you're saying in relation to raising issues that the government needs to respond to. But what I don't accept is this characterisation that there's nothing to see here, or that's the response from government. There's a lot to see here, and we see it, and we're trying to respond to it. That's why staffing numbers in the HSE have grown by 22% in the last 4 years. That's why we're spending over €23 billion on healthcare now. And we are seeing results from that expenditure in terms of waiting times falling, trolley numbers falling. Are there still problems in our health service? Of course there are. And we're seeing those pressures in a very real sense, both on staff and patients in Limerick today. And we acknowledge that. And that needs a response from government, and it's going to get one. As well as from a management point of view.
Cancellations happening. Something's going wrong in the system.
The highest life expectancy in the EU.
Deputy.
Procedures.
Deputy, you know when a health system moves into, it's escalated into a pressurised management situations. You need to prioritise the patients who need beds most. And that's what's happening in Limerick today. Is that welcome? It certainly isn't. We have surge capacity, using other beds in the region as best we can, and this is a temporary arrangement that we will move beyond as quickly as we possibly can.
I just remind members, it's leaders' questions, you know. It's leaders' questions. Okay. So Bogamidjarai and Ishkuji and Gruppe Regunach Ihakta Dennis Nachta.
Minister, long COVID is tough on individuals who are dealing with ongoing health problems like tiredness, trouble thinking clearly and breathing issues. But it's not just having an impact on individuals, it's also having a profound impact on our workforce, presenting challenges that are complex and far-reaching. A report just published by the EU Commission provides estimates on the prevalence of long COVID and its impact on people's ability to work. This indicates that the prevalence of long COVID in the EU population at 2.9% in 2022, resulting in a negative impact on labour market supply of between 0.3 and 0.5 of 1%. In person equivalents, these figures mean long COVID could be reducing labour market supply here in Ireland by over 12,500 people. That's combining the effects of lower productivity, higher sick leave, lower hours worked, increased unemployment and underemployment. Of course, the real number of individuals impacted will be much higher because this is only a statistical model. But these figures may very well be far worse, because the sole indicator of the magnitude of long COVID challenge here in Ireland, based on actual Irish data, depends on a survey that I commissioned last year. It suggests that an estimated 5% of adults are living with symptoms of long COVID, which would equate to the impact on the labour market of over 22,000 person equivalents. This is not only leading to a significant reduction in labour supply in an economy at full employment, but it also has long-term implications for society as a whole. Minister, what these figures highlight is an urgent need for adaptive workplace policies and comprehensive health support services. Sadly, we're still waiting for the regional long COVID clinics to be fully functional, despite being promised in September 2021. Furthermore, the mental health repercussions of the pandemic and long COVID cannot be overstated. There has been an increase in demand for mental health services driven by the pandemic's exacerbation of mental health issues. For example, the increased prevalence of antipsychotic drug prescribing points to a deterioration in mental well-being, particularly among younger and older people. Minister, we need an action plan which not only acknowledges the challenges post-COVID and that of long COVID, but one that helps people to recover, to return to work, and most importantly, to become full contributors to our society once again.
Minister.
Deputy, thanks for raising this issue, and to be fair, you've been really consistent in raising this issue for many months now, in terms of keeping the government under focus and pressure in terms of an adequate response. Can I just put on the record the fact that the European Commission has made a non-binding recommendation now on the recognition of COVID-19 as an occupational disease. It did not make a recommendation, though, in relation to long COVID, which I know is the issue you're raising primarily. The decision regarding recognition is a member state competency. It's important to note that recognition in Ireland would not encompass long COVID and would only apply to new claims for new cases of COVID-19, and it would not benefit those who contracted COVID-19 during the pandemic, which is primarily the cohort that you're talking about. The report published by the Minister for Social Protection and laid before the Oireachtas last November found that COVID-19 does not meet the criteria for recognition as an occupational illness under the Social Welfare Consolidation Act. Specifically, it found that presumptions about workplace transmission would not be sustainable on a general basis in the current environment. The government, as you know, did an awful lot during the pandemic and subsequently in terms of supporting people whose work was impacted by the fact that they had COVID for an extended period of time. We had an enhanced illness payment and system and eligibility criteria that set to maximise the number of workers that could apply for it. That scheme paid out some 788,000 claims at a cost of over 350 million. A temporary scheme of paid leave was also developed by the Department of Health for certain public health sector employees who were unfit for work after a COVID-19 infection. Special leave with pay for COVID-19 was also introduced for public sector workers. The Department of Social Protection continues to provide a suite of income supports for those who can't work due to illness and disability, including those that have not recovered following a COVID-19 related illness. COVID-19, though, doesn't meet the criteria for recognition as an occupational illness under the Social Welfare Consolidation Act. Specifically, presumptions around workplace transmission would not be sustainable on a general basis in the current environment where infection rates are low. In other words, there isn't a sufficient level of proof that people got COVID through their participation in the workforce as opposed to getting it through community transition. So what I'm saying is that various different departments, the Department of Health, the Department of Social Protection, my department, are looking at ways in which we can respond to people who are unable to work due to extended illness linked to COVID. I accept that the government does need to progress and quickly the regional long COVID clinics, which have been promised. And we will certainly, from a Department of Enterprise perspective, keep this issue under close review.
Minister, Deputy Grealish, Deputy Canny and I, as 3 Galway TDs, believe that the government should reconsider its decision to terminate at the end of this month the special leave entitlement for frontline healthcare workers who are unable to return to work due to long COVID. These 143 staff contracted COVID-19 before a vaccine was available and in many instances before sufficient PPE was available. They've been suffering from long COVID symptoms now for over 2 years. Minister, frontline workers were publicly commended here in Dáil Éireann during the pandemic for risking their lives, as well as that of their families, to deliver essential services. But the vast majority of them with long COVID symptoms have been ignored by the state through its failure to recognise it as an occupational illness. And Minister, the very least we should do is to support this small number of healthcare workers now in their hour of need. And finally, Minister, can I ask you to look at the labour market implications of long COVID on foot of the recent EU report on this? Thank you.
Minister, to conclude.
Deputy, as I said, the temporary scheme of paid leave was developed by the Department of Health for certain public health sector employees who were unfit for work after a COVID-19 infection. That scheme, as you say, is due to end on the 31st of March, which is the end of this month. But I'll raise the issue with the Minister and ask him to come back to you directly rather than giving you a sort of a stale answer here. But I can understand what you're saying. What I'd like to understand is the numbers that are impacted and their circumstances, which I presume the Department of Health has. But I'll ask Minister Donnelly to come back directly to you on it, if that's helpful.
Ik bug Ryan Ishkuji an Chestierna, ik had de Michael McNamara.
Minister, the regional disparities in this country are stark. I was in Cork over the past 2 weekends for family reasons, and the advances in infrastructure over your time in office is quite remarkable, and it's been particularly accelerated in recent years. It's in marked contrast to infrastructural advancements in the Midwest and the South East, or basically any other part of Munster. Likewise, there were advances in those areas, like the ring road around Limerick or the partial ring road around Limerick when Willie O'Dea was in Cabinet, the road to Waterford when Martin Cullen was in Cabinet, but no Cabinet Minister, no advances it seems. And I wonder if that parochialism is part of the reason that our offshore wind strategy is so behind the laudable targets that the government plans. But a target is not a plan. Every couple of years the government comes out with new targets. And we've no plan to meet those targets. Now, there was a Shannon Area Task Force report launched on the 8th of July last in Ardnacrusha. You were there, Minister. The Taoiseach was there. Norma Foley was there to fly the Fianna Fáil flag, and Eamon Ryan was there. And it became clear at that wind energy, and particularly floating offshore wind energy, has the capacity to really revolutionise the state, how we provide energy for our households, and how we provide energy for the industries that want to invest in Ireland. But there's been little advance since then, as it often is with reports in Ireland. I mean, essentially, there are three key demands from the Shannon Estuary Task Force. One around demapping the West Coast. Surprise, surprise, the South Coast is progressing in that regard. The West Coast, which has the greatest potential, it seems, and that's what experts say, there's very little advancements in it, notwithstanding the fact that Clare County Council have been prepared to offer significant expertise in that area as their contribution. We need an ORIS offshore wind auction for floating wind. We don't know when that's going to happen. And supports for ports. And again, Foynes is going to have to be developed if we're going to harness the wind energy capacity off the West Coast. Very little advance in that. And I'd like to hear what the government have to say to that.
A lot in that question. I'll try and answer the various different elements of it. First of all, I'm glad that you're noticing progress in Cork. Always important in terms of the scale of development there. But can I just say the Midwest has had a great year too. You know, if you look at the performance of Limerick and the Midwest more generally in terms of IDA announcements this year, 3 of the biggest announcements in the country happened just outside Limerick. You know, Analog Devices, Eli Lilly, Verizon, thousands of jobs, hundreds of millions of euros of investment coming to the Midwest over the next few years. And we're also seeing a lot of infrastructure delivery on the back of that. You know, a rail connection to Foynes Port, the Adair bypass, progressing, albeit slower than some of us would like, a motorway between Cork and Limerick. But 4 million euros allocated to that project in the last couple of weeks. So there is a lot happening in the Midwest, but a lot more is going to happen in the next number of years. The Shannon Estuary Task Force did a fantastic job. I've met that task force a number of times, and I've spoken to its chair on many occasions now. And yes, the big ask from them, from a wind energy perspective, offshore wind energy perspective, is to ensure that Shannon Foynes is at the centre of the country's plans to assemble and bring ashore offshore wind-generated power. And that's going to happen. It's just a question of how quickly. We do need to get a DMAPS process underway in the west of Ireland, along the west coast of Ireland. That's happening for the Irish Sea and it's happening for the south coast. It's a resourcing issue to make sure it happens on the west coast as well. I am determined to make sure that the west coast is not left behind here from a timeline perspective. Minister Ryan and myself are working on getting the resources in place to make that happen, and Clare County Council have been very helpful in that regard. We're also looking at a demonstrator floating wind project off the west coast and a centre of excellence. Yesterday I got approval in Cabinet for an offshore wind. So there is a lot happening here, and in my view the technology development powered by clean power coming onshore from both fixed and floating platforms off the west coast that are generating power from wind.
Minister, I suppose your determination is laudable, but it seems to be, I just wonder, when it meets the inertia of Eamon Ryan's department, which is going to triumph, because there's little coming out of government. Yes, you acknowledge what needs to be done, but we all know what needs to be done. That's why you put a task force together. The reality is it's not happening. Even the industrial wind strategy of your own department, I think, it lacks specifics with regard to what will happen in the West Coast, Minister, not to mention the other plans that the government is coming up with, which fail to prioritise wind energy. I mean, I've heard the Taoiseach express similar determination, describe it as our moonshot. But that rhetoric is completely unmatched by the reality of what's not happening on the ground and what needs to happen on the ground. And with respect, Minister, the ground in which we need to see development is the Midwest, if we are to harness wind energy, and floating wind energy in particular, off the West Coast. And we need to do it now.
Minister, to conclude.
Yeah. Look, Deputy, I hear the frustration, but I can assure you there's no lack of ambition in Minister Ryan's department or in mine on this. You know, Minister Ryan has done an extraordinary piece of work, in my view, in the last number of years to make this prospect now a reality. Like, we've had our first round of auctions. 3 gigawatts of supply contracts, draft supply contracts in place. One of those projects, by the way, off the West Coast, off the coast of Connemara. So this is happening, but you don't deliver a plan that is aiming to deliver 37 gigawatts of offshore wind power generation in 25 years. You don't deliver that overnight. You've got to change a planning system, a permitting system, a marine plan, which is all state-led and happening. And you know, all I can say to you is that this is going to take a number of years to take shape, in particular off the West Coast. But Shannon Foynes will be at the centre of a lot of that. And we will see hundreds of millions of euros of investment on the back of it. It costs about €3 billion to put a gigawatt of power generation capacity offshore, and we're planning to do nearly 40. So that gives you the scale of investment that we're likely to see over the next 25 years.